Over the past year, the Illinois State Medical Society secured a number of important victories for its member physicians and their patients. Just as important, we are now pursuing an aggressive agenda for 2015. ISMS successfully lobbied on behalf of physicians to pass important new laws, stopped several bad proposals, and worked with lawmakers to amend certain bills to ensure patient safety, while at the same time avoiding unintended consequences. ISMS initiated changes to make advanced directive forms more accessible to patients. APNs and PAs can now sign the POLST form with a collaborating physician's approval, and the Power of Attorney for Healthcare form has been rewritten so it now reads at high school level. Retired physicians who volunteer without receiving payment will be eligible to receive a no-cost medical license. Licenses will soon be accessible once IDFPR completes the rulemaking process. ISMS stopped flawed proposals that would have inappropriately expanded scope of practice rights for naturopaths, physical therapists, and pharmacists. We successfully amended a bill that would have allowed dentists to provide a broad array of vaccinations, limiting them to adult flu vaccinations instead. A dangerous clinical psychologist prescribing bill was amended to ensure that psychologists undergo significant training before being allowed to prescribe medications. Due to ISMS advocacy, the Illinois Workers' Compensation Commission increased payment rates for non-surgical evaluation and management services by an average of 9.5%. In early 2014, ISMS initiated an application with the AMA CPT editorial panel for the creation of codes to document physicians' advanced care planning discussions with patients and their families. ISMS scored a big win when the panel approved our request. Another round of advocacy will occur this year when Medicare is expected to review the codes for inclusion in the Medicare fee schedule. Medicare's payment for these doctor-patient discussions is an important first domino to fall, as private insurers tend to follow Medicare's lead regarding reimbursements. ISMS is a consistent advocate for making advanced care planning resources available to patients. Our A Personal Decision booklet contains many sample forms and is available for free download to anyone. ISMS members can obtain up to 300 free printed copies per year. ISMS is not resting on past accomplishments. Instead, we are pursuing an expansive advocacy agenda for 2015. That agenda includes fighting off legislative proposals that are not in the best interests of patients and their physicians. For example, two clinical areas of concern are continuing to attract legislative interest: mandatory hepatitis C screening of high-risk patient populations, and mandatory physician training for the prescribing of opioids, along with other restrictions on physician prescribing authority. ISMS opposes legislation that dictates the practice of medicine or mandates specific continuing medical education. Such proposals are bad policy and set bad precedents. On another front, ISMS is reviewing the implementation of the Affordable Care Act in Illinois and considering legislative options to address issues that negatively impact physicians. These include mitigating the possibility of uncompensated care when a physician treats a patient who falls within the coverage grace period of an ACA plan, as well as making certain that insurers maintain adequate physician networks for ACA plans. We are also prepared to defend against a full slate of scope of practice expansion bills. ISMS advocacy comes in many shapes. Be sure to access our members-only materials, such as recent publications dealing with social media, medical cannabis, and issue briefs on a range of topics, including our patient flyer, which explains payment for preventive care services. ISMS is a staunch advocate for physicians in the courtroom and with insurers. Recently, we submitted an amicus brief in a case before the Illinois Supreme Court in our continuing effort to protect the confidentiality of medical staff credentialing data. ISMS regularly advocates for our members on insurance company practices. Members can use our hassle factor log or call our expert staff to request assistance. And remember, we can only be successful with support from our members. If you haven't already renewed your membership, please be sure to do so. Show your support for IMPAC this year. IMPAC spent heavily in the last election cycle and needs to replenish the coffers. A handful of trial lawyers were able to raise more than $2 million in less than 60 days to oppose an IMPAC-supported Supreme Court judge. Fortunately, our candidate retained his seat. In order to keep up, IMPAC needs your contribution. ISMS offers several options for staying informed. Our website is updated frequently with the latest news and information that's important to physicians. And ISMS recently launched a smartphone app which offers updates and social media access. ISMS members can also read the latest news in our flagship publication, Physician Advocate, which is sent via email every other week.